Interpreting urinalysis results, you need only to look at 3 parameters of urinalysis. 1, visual appearance. Put your emphasis on the visual appearance, urine dipstick, and microscopy. So we have visual exam, the dipstick, and microscopic examination. So you have to be able to interpret all these 3 parameters, because all the 3 give us the clue of the patient and actually what they are suffering from in case there is any deviation. So if you fail to interpret the visual, you fail to interpret the dipstick, you fail to interpret the microscopy, then you're in a mess. But I will go through it slowly by slowly and actually you understand it. 1, let's begin with the physical appearance of urine. So in the results, they may give you the appearance and the color. The color might be yellow, darker yellow, red, or either they can give you the appearance as either clear or cloudy. So now how do you interpret this? If it is yellow and clear, that is normal urine. Darker yellow is a sign of dehydration. If it is red, means blood is present. The dipstick and the microscope will help us here. If the urine is cloudy, think about the infection or crystals. So we shall need to check for leukocytes and the nitrites. So the conclusion at this step, normal versus suspect infection. So have to be able to see or to interpret the physical appearance. 2, these results always have specific gravity, which is always abbreviated as SG. What is specific gravity? So specific gravity tells you how concentrated the urine is. And actually the normal specific gravity is between 1.005 to 1.030. So if you get the results and maybe the SG, the specific gravity is 1.030, that is normal specific gravity. High specific gravity greater than the normal I've mentioned is suspicious of 1, dehydration or glucose in urine. And the lower specific gravity from the normal, it is an indicator that the kidneys are not working well. Kidneys are not concentrating, or there is over dehydration. And if the specific gravity is fixed at 1.010, that is kidney failure. So in brief, specific gravity tells you your hydration status and the kidney's concentrating ability. 3, you have to look at the pH, the acidity or the alkalinity of the urine. The normal pH of urine is between 5 and 8. If the urine is on the side of alkaline, maybe 8.5, 8.3 and above, think about urinary tract infection, especially proteus, or you may think about vomiting. If the urine is acidic, think about diabetic ketoacidosis, or you may think about diarrhea. Those 2 lowers the pH. In other words, pH supports infection or metabolic disorder, simply like that. Step 4, look for proteins. For example, they may tell you proteins plus, or either +1 or nil or +2 or 4 pluses. So what does this parameter indicate to you as a clinician? The normal urine is supposed to have negative proteins, no proteins, or trace. If there are 2 pluses, it may mean fever, it may mean urinary tract infection, or either pre-eclampsia or eclampsia. I'm not going to detail of that. If the proteins are 3 and above, 3 pluses and above, plus, this is an indicator of renal disease, majorly in the glomerula. Step 5, look for glucose. They may present you results as glucose +1, glucose +2, or +3. So normal urine is supposed to have nil or negative glucose. But if it is positive, you query diabetes mellitus. It's one that always presents with glucose in urine. Unlike diabetes insipidus, which presents with the clear, colorless, hyperdiluted urine. 6, urine always has kidneys. They always present results with the kidneys, which can either be +1 or negative. Normal urine is not supposed to have any ketone bodies. If there is any positive ketone, that means your body is undergoing fat breakdown. And fat breakdown is always seen in diabetic ketoacidosis, is seen in starvation, and is also seen in vomiting. 7, urinalysis presents, they always give you a parameter of blood. They may give you either blood negative, +1 or nil. Normally, urine is not supposed to have any blood. If they say positive, just know now blood pigment is present. And here now we have to go to microscopy, which may give us that red blood cells are present. And if red blood cells are present, that is hematuria. If no red blood cells, it might be either hemoglobin or myoglobin. So the purpose of blood in urine as to a clinician is bleeding versus muscle breakdown. Step 8 are the leukocytes. Urinalysis presents with the leukocyte esterase, or what we call LE, which is supposed to be negative in a normal person. No leukocytes are supposed to be present. If leukocytes are present, then pus cells are present. And the clinical meaning here, it supports urinary tract infection. Another parameter in urinalysis are the nitrites. In a normal person, they are supposed to be negative. But if they are positive, it supports that there is a gram-negative bacteria present. The clinical meaning here, it confirms urinary tract infection. Now, step 10, we go direct now to the microscopy, which confirms everything. For example, the metal white blood cells are between 20 and 30 per HPF, or red blood cells are between 10 to 15 per HPF. Leukocyte cells, none seen. And now what are the interpretations here? Increased white blood cells, think of urinary tract infection. Increased red blood cells, think about hematuria. No casts seen, the cause is lower tract. Let's try to put all this together and see. For example, let me give you example 1. A patient has a clouded urine, leukocyte esterase +1, nitrite +1, white blood cells increased. Diagnosis is urinary tract infection. Example 2, red urine, protein is +3, blood +1, red blood cell casts. The diagnosis here is glomerulonephritis. You see how things becomes easy? Example 3, you have former urine, proteins +++, there are 4 pluses, and there are fatty casts on microscopy. Diagnosis, that is nephrotic syndrome. Example 4, high specific gravity, glucose +1, ketones +1. What's the diagnosis? Diabetic ketoacidosis. So golden rule to memorize: never interpret one value alone. Interpret in patterns. The appearance, the dipstick, and the microscopy.